Hello, good morning. Hey, good morning, Rose. How are you doing? You okay? Okay, no worries. I'll start. Hi, good morning, everyone, and welcome back to today's session on Learning Outcome 4, which will be covering under the unit Leading Practice in Health and Social Care. This is the last learning outcome that we'll be looking at covering, slightly, bigger learning outcome with a couple of additional slides that I've added to make the discussion in a bit more detailed. But let's look at dwelling into this particular learning outcome, which talks about be able to lead and develop others in the health and social care. So essentially here, when we talk about, the concept of be able to, we are looking at, essentially, looking at doing it ourselves. That means we need to be able to, look at practically doing and quoting examples to show application of how do we look at training and development within the health and social care sector. So be able to is also meaning that we are able to do something. You have to be able to do it to be able to evidence it in your assignment. And that is why the last two learning outcomes in particular, if you see last three in fact in this particular unit, are more about you having to use some of the templates and some of the discussions that we've been doing to choose a place of your work or look at an organization and look at the role in your organization in health and social care, and then using that role as a reference point, you're required to complete some of the tasks in the assignment. So understand is more theoretical, wherein you are understanding the knowledge and theoretical aspects of it, the key framework, the key concepts, and terminology side of things. But when we talk about be able to, you're essentially looking at doing it, doing it yourself. That means you're able to basically showcase with the use of examples and your own experience at the place of work to collate the evidence to complete some of the tasks in the assignment. So some of these learning outcomes, when we look at be able to develop strategies, that means I'll have to be able to literally do it. That means I'll have to create a plan to show how health and social care strategy is developed, or how a corrective action plan that you undertake at your workplace is essentially done by showing the necessary steps of how you would go about doing the planning and how you would carry out some of these roles and responsibilities. So similarly, in today's learning outcome, it is about being able to lead. That means you'll have to take examples and show the application of these examples to establish convincingly that how you are able to essentially develop and help develop other subordinates, peers, colleagues within the place of work, in the health of in the place of work, which means the health and social care sector or your organization, whether it's a care home, the national service, you work in whichever part of the organization, you'll be looking at taking up examples to show this. Now, there are 4 assessment criteria that we are going to be looking at today. One is critically evaluate. So as you can see, also sometimes, the order of command verbs increases as we go down. So this is going to be looking at critical evaluation, which means we are going to be looking at talking about, pros and cons, advantages, disadvantages. We'll be looking at maybe, reaching some sort of a conclusion. And that would be on the basis of arguments that we put forward for the purposes of evaluation in this particular task. So here we are looking at the role of leader in promoting and communicating organizational vision. So we will need to talk about what is leader, what is leadership, what is their role within the organization when it comes to, defining mission vision of the company or the organization, and how this is useful basically how this is useful in driving everybody behind that goal or objective, so that everybody sings from the same songbook in a way. But also look at how leaders have the ability to be able to influence colleagues within the organization, and get them behind their vision to go out and achieve the objective. So that will be the first assessment criteria. The second one that we'll be looking at is evaluating theoretical concepts which are behind, fostering team working environments in a leadership role. So here, essentially, we are going to be looking at team roles and how team building and team roles and teamwork as a concept came about. So we'll be looking at Tuckman's model of, the forming, norming, storming, the five-stage Tuckman's model of team building or team formation. And then in a later part of that discussion in the assessment criteria, we'll be looking at Dr. Belbin's work and how he came about with the 9 different roles which people take up when teams are formed, and he categorized them into 3 different categories. So we will discuss those roles to be able to cover this particular task. The third assessment criteria talks about importance of developing a team that promotes professionalism and mutual trust. So here the emphasis is to discuss the reasons why teamwork is required within the health and social care sector, how teamwork inspires us to look at delivering on our roles and responsibilities. And when you deliver them in terms of completing those tasks, or for example, completing and achieving the day-to-day duties which have been given, then how do you deliver them and how do you complete them by showing and exercising professionalism? The reason why professionalism is required within the health and social care sector, so that care standards do not slip, quality in terms of delivering of care is maintained. You're observing key legislation that we've discussed in the learning outcome 2, things like dignity, the 6 C's of person-centered approach, the care standard principles that we adhere to, the 14 principles. So those are a part and parcel of your professional conduct as a nurse, as a healthcare worker, a healthcare assistant, as a healthcare professional, and how do you use these to deliver key services that you provide to members of public, patients, or people who are ill and are receiving treatment at a particular place. Last assessment criteria talks about discussing how leaders support developing of teams, and within the developing of teams, the important focus on how they contribute towards the development of an individual through a process called continuous professional development, or CPD. And this is something that we've seen in the first learning outcome, that continuous professional development is a key part of this particular sector, as in other sectors like teaching, medicine, dentistry. Some of these sectors have a key part wherein a key element which is essentially required to be able to work at the best proficiency and productivity level of the role that you work within. And this is primarily done through continuous training, continuous development, picking up reskilling, and maybe picking up new skills by attending various events, which could be seminars, trainings. It could be trainings which are organized by the employer, trainings or self-managed learning that you do at your end. So here the idea would be to try and develop a CPD plan or a continuous professional development plan. But as a key requirement for the task, we are essentially focused on understanding how leadership, or how people in the management and leadership of the organization can contribute positively towards the process of continuous professional development. Now, as always, in order to discuss this particular learning outcome, I've got a few presentation slides that we'll be looking into. As I mentioned to you earlier at the start of our discussion, what I've done is, because there's a fair bit of indicative content and it dwells into theoretical concepts, and these theoretical concepts talk about motivational theories, leadership theories. So some of you who haven't previously, say, for example, read or, gone about reading, say, for example, in your previous place of work or maybe in other units about some of these theories, then what I've done is I've created detailed slides. Although when we discuss this, we'll be looking at practical applications of it, because it talks about evaluation rather than going into the theoretical aspects of understanding the theories. But I think the slides that are developed, what I'm trying to say is you'll be able to read through these slides and also get the knowledge which is required to understand some of the background of these theories, which have been asked to be covered in this particular learning outcome and some of its assessment criteria. So a fair bit of content where we'll be looking at understanding this in four broad parts essentially, and they would include things which will talk about leadership, definition of leadership role within an organization. We'll be looking at the concept of motivation and how is it closely related to leadership and the delivery of leaders trying to ensure that everyone understands the mission and vision of the organization and get behind that to be able to achieve the objectives. The third part being team building, and why team building and team building approach is important within the National Health Service, although we work mostly within multidisciplinary teams. But essentially, the core idea is that you're working within teams when we talk about the National Health Service and the health and social care sector. And last but not the least, looking into building a deeper understanding in the process of continuous professional development and how leadership within an organization can essentially go about supporting it. Now, as always, before I start, I always look at the key terminology, the key words, which will come across in the learning outcome time and again. So we'll be looking at, using the word and the term leader, leadership, teams, and that is where, we need to be able to place it in the context of health and social care, because some of these topics are quite broad and they are generic and they come across, you will come across these topics in management, in general areas of business during working in your an organization, and they sometimes also reflect some of the operational areas that we get to see within the organization and different teams. So even within the NHS, although the core function is providing healthcare services, care services, integrated services in terms of delivering care to patients who are ill or are receiving care essentially and treatments essentially to get back on their feet. There is some part of the organization within the setup which basically only deals with management related functions and functions which are related to essentially business operations. So in those cases we will be looking at the aspect of leadership, the qualities of leadership, the attributes of leadership, the theories which are put into practice at your place of work, and also how people within these positions, when I say these, I mean management and leadership positions, contribute towards the effective and efficient working of the system and the processes which are required to deliver these services to the patient. So let's look at the word, if I just briefly mention the word leader, if we start with that and basically look at what does the word leader mean. Now, leader is a person essentially who leads the organization, commands a group, or, it could be a person who's heading the, the country as well. So in this case, if I talk about leader of the House of Commons or leader of the House of Commons in this case is say for example Penny Mordaunt currently, who has been nominated as the person, and she manages some of the aspects of the Tory party as far as the operations or the functions of that is concerned within the parliament. Now, when we talk about a leader, it could be a leader which would be in the army, a general. It could be a leader when I talk about an organization. Elon Musk is the CEO of Twitter, Tesla, SpaceX. So he's a leader who leads that organization. And when we talk about the NHS, somebody who's at the head of the NHS, or in terms somebody who's the head of NHS England, say Amanda Pritchard, she is the chief executive of the NHS England, and she's basically leading obviously the executive group, which essentially runs the National Health Service in England in particular. So they, when I say they, I mean people who essentially, look at leading the organization in terms of making decisions, setting the vision and the mission of the organization to be able to achieve long-term, short-term objectives, are people who are termed as people who are in the leadership position, or they have the helm of the organization. Now, there are various definitions of leadership. So when we talk about leadership, Forbes, for example, defines it as a process through which social influence can be exercised, and that is exercised by the person who is the leader of the organization, and it is done primarily for the achievement of a goal or the objectives which have been set by the leaders for the organization. Now, according to Harvard Business Review, there are lots of definitions, but looking at some of the popular ones here, it talks about leadership as being the ability of an individual or a group of individuals to influence and guide followers and members within the organization to achieve these objectives. So when we talk about leadership in general, we are basically looking at talking about the actions which these people take by leading a group of people or sets of team within an organization to be able to achieve objectives which are set by the management or the board of the organization. So in the case of NHS, the top executive board basically sets the yearly objectives, and that is carried out. These objectives are then put into practice and implementation is done, and they are carried out by various teams working within the Department of Health and under the NHS to be able to deliver these services to the members of public. And essentially in this case, you're looking at people being responsible for essentially delivering I would say the objectives which are set. So in those cases, you're looking at, talking about essentially people involved in, delivery of, in basically ensuring that resources are put, if I put it this way, resources are put to good use, budgets, objectives are achieved within the budgets which have been set and the timelines which have been set. And when we look at the leadership model in the NHS, the National Health Service, it has basically 9 dimensions. And it talks about, that leaders will be looking at leading with care. They'll be sharing the vision of the organization with all the staff, individuals, employees within the National Health Service. They'll be looking at influencing the results to ensure that results are achieved. For example, A&E wait times need to be brought down to 2 hours. So chief executives and the executive board is essentially looking at influencing these results to reduce the wait times for the ambulances and, patient wait times when A&E and ambulances pick up patient and obviously bring them to the A&E. They'll be looking at evaluating information. They'll be looking at inspiring shared, purpose or knowledge, development of skills, and obviously looking at ensuring that there's a connected service delivery model which is available to the members of public so that you are able to get all the necessary treatments which are required from the NHS rather than, some of them being outsourced. So developing capacity and also holding at the end of it accountability are the key aspects of the 9 dimensions of leadership model within the NHS which are defined. So in general, when we talk about leadership in health and social care, we are looking at leaders helping, or people at the top at the helm are looking at promoting the development of knowledge and skills which are required in the staff, which will allow them to essentially deliver care or provide patient care which is within the remits of the laws and statutes defined, ensuring that safety, compassion, and good experience is delivered when patient care is being provided by the National Service. And in order to make sure that staff, employees, contractors, suppliers, they all work with the same objective, the National Health Service, also the chief in this case, or the management essentially also puts into place a carrot and stick approach. That means if you do things right, you get rewarded. If you obviously don't do things right and there are mistakes which are happening, then obviously reprimands and, are also given, and, inquiries are also set up. But generally speaking, leaders within leadership role within the health and social care sector is to primarily lead the staff, provide a vision, keep them motivated to be able to deliver services to the highest possible standard, and also ensuring that they are able to nurture talent to be able to develop them with new skills and provide them newer opportunities to be able to prosper and obviously develop in their roles and thereby providing, care as per the standards which have been set by the NHS Act, by regulators like the Professional Standards Authority and the CQC, in order to ensure that members of the public get the desired, service or care for a particular condition if they have come into the NHS to receive a treatment or get better, and in terms of being diagnosed with treatment and getting the effective medication and diagnosis to be able to get back soon or get well soon. Now, there are lots of attributes of, so if I name this slide, there's lots of attributes, to leadership skills. But in particular, when we look at leadership and attributes of leaderships within the health and social care sector, they are focused on strong communication. They are focused on solving problems. They are focused on time management, and it allows for flexibility and emotional intelligence to be applied so that patients are dealt in a way wherein we understand their emotions, we give them respect, we give them dignity. We also give them information so that they're able to make independent decisions, and decisions are not forced onto patients to be able to make. And this is what the leadership in health and social care sector is focused about. Now, there are lots of different types of models, but there is one particular model which we get to see in terms of how leadership as a concept is approached within the health and social care sector. And this tends to be the logic model of leadership, which is widely used in public services, in public sector in particular. And this particular model focuses on 4 different types of activities. So it looks at resources and asset, which are basically required for people to be able to work. We focus on activities that they carry out with using these resources and assets, and then what could be the output which is generated, and that output, what kind of an impact would it have on the service delivery model, or in this case, when we talk about the NHS National Health Service, what kind of an impact will it have in terms of the output of services which the patients receive, from various places within this sector, whether it's the hospitals, the surgeries, the community centers, the A&E department, pharmacies, anything which is associated with this sector, the output of it and the measurement of the impact in terms of how these services are received are essentially done using the implementation of the logic model. Now, resources and assets essentially would be looking at every sort of resource: human resource, financial resource, administrative resource, physical infrastructure, operational resource. So these are all the resources which will be looked at. And there is about £20 billion worth of funding which is done for these resources annually every year within the National Health Service. Now, when we look at activities, we're talking about activities which are put into place by management with the goals which have to be completed by carrying out those activities, and everybody then understands the shared vision and mission with which these goals and activities are set in the short term, 12 to 15 months, and in the long term, 3 to 5 years. Now, the output is obviously measured, which is closely related to the vision and the plan which has been created. So when you look at the NHS Act and you look at the plan which NHS has, the 2025 NHS plan, there are certain key aspects of this plan which every staff, every person working within the organization needs to understand and needs to work towards to the best of their leadership capabilities to be able to make sure that they are contributing towards delivery of this particular plan. And then towards the end, white papers are published, reports are generated, and say for example, sometimes you would see that committees and reports are generated or action in order to ensure that the output at any given point in time, for these long-term plans which are put in place, are measured to see if the leadership has been effective in essentially ensuring the delivery of these objectives, within the organization. So this logic model is something that we need to be aware of, which is a model which is implemented very closely within the National Health Service, specifically looking at how people in leadership positions. And when we talk about the 9 dimensions of the leadership model in the NHS in particular, that is based on, ensuring that the teams and the vision which has been set by the chief executive and the executive board is followed through in terms of delivery of some of the and it follows through and is becoming and is an integral part essentially of the services which is delivered by the National Health Service. Now, with this particular background in mind, what we want to be able to do is get into some of the assessment criteria and then discuss in a bit more detail this particular learning outcome. The first one, which we look at, talks about essentially, the critical evaluation of role of leaders in promoting and communicating organizational vision to others. So, in this case, when we talk about the concept of leadership, when we look at, according to, say, one of the career coaches, Jen, she defined that, when we talk about leadership, it is essential that leadership shows people in this position actually show some skills, a particular type of behavior, and have attributes and exhibit certain styles which are easy to identify. And obviously, this allows people to this allows them to influence people so that they can follow the mission which has been set to deliver on the objectives of the organization. And now, when we talk about leadership, it also needs to be quite effective. It needs to have clarity, and obviously, this can only be done if everybody sings from the same songbook. So sometimes when organizations, and when we talk about NHS and vision of the NHS, the statement of NHS and vision and mission of NHS, this is something which has been very carefully defined, essentially in this, when we talk about the vision and mission, in general, if I look at primarily, talking about with a direct reference to how this has been set, the vision of the NHS, when it was coined, is basically, talking about ensuring that, they work in partnership with a lot of different organizations which are able to provide, services to the members of public in terms of receiving, care services. But when they look at providing this, they also want to ensure that the care being provided is actually meeting the standards of care. It is following, a system which is basically based on improvement. They are looking at honestly brokering relationships or working within multidisciplinary teams with partners and suppliers, and also ensuring that any given point in time, when any advice, whether it's general advice, clinical advice, when it is given, the leadership is supporting in that process of decision making and strategic planning for delivery of some of the objectives within the National Health Service. So it is important, regardless of your position that you work within the organization, it is important that you have a very good understanding of the vision and mission of the organization, so that your roles and responsibilities are related effectively to helping in achieving the company's objective. And that is one of the key roles which people at the top have to look at promoting, and have the responsibility to ensure that everybody understands what is the reason the organization exists, what are the services it provides, how it provides these services, what are the basic legislation and frameworks which are implemented and have to be followed while delivering this particular service to a patient or a member of public within the UK. And this is a very critical part of their role to ensure that everybody understands this. So they simplify. Maybe the simplification of what is being communicated also needs to be done to a certain extent to ensure that the understanding on the requirements from them when they carry out their day-to-day responsibilities is clear. And when they do these, they add up to other responsibilities in terms of helping ensure delivering of objectives which are set. Now, when we look at say, for example, I'll substitute the word business with organization. So when we look at the importance of leadership, it is very important that people at the top are able to also motivate the teams, or motivate people to be able to take up the jobs and also be able to deliver on their job responsibilities. So when we look at how leaders essentially, let's say, promote and ensure communication happens within the organization. They also look at, working and breaking the, let's say not breaking, they also look at putting people together into teams. And sometimes putting people together into teams helps also achieve bigger objectives which are set, because they are not individual objectives or not tasks which can be achieved by individuals, but a group of individuals. And in those cases, they encourage teamwork to happen, as far as, working within the organization is concerned. So the role of leadership, and for it to become effective and to become purposeful, can only happen if they look at, if they are able to motivate the staff, if they are able to get the staff behind them in terms of carrying out those activities, and they're able to build effective teams or winning teams, if I may use the word, to be able to carry out some of these difficult tasks which are not individual led, but which are team led, so that if somebody is requiring, say for example, if the hospital requires, a particular area of the hospital primarily is not working well, or maybe is not able to meet the objectives, then the review of that particular department would, from the leadership, would basically be looking at understanding what are the problem areas where the issues are being faced. Are the employees having adequate, training and development? Do they have the skills to be able to provide this service? And after identification of these problems, what they would then tend to do is put a plan in place which will maybe reskill or upskill the existing employees to be able to deliver on their job responsibilities. We'll be looking at, some sort of a corrective action project, or, a plan which will be put in place to make these changes gradually over a point in time, so that there is no resistance to change. They are able to get everybody behind, and accepting to take up this particular change. And last but not the least, it is done through a timeline in a way wherein people are comfortable, going through that process of change, and they understand why it is being done, what benefits would it bring, and at some stage, also then looking at towards the end, ensuring that, the purpose of realigning or streamlining the operation by which this particular exercise was undertaken is actually achieved. And that would be the role of leadership. Now, leadership also looks at promoting values. They also look at promoting creativity. They also look at promoting coordination. These are effective, these are points that we need to look at, because these are all the things which leaders need to do in order to ensure that they are helping to achieve the aims and objectives of the organization. Now, when we look at leadership in general, within the NHS, we are also looking at leaders being able to effectively communicate. They are very good communicators. They are able to get the attention of the employees, staff, contractor, suppliers, by providing the right amount of information, and make it promote it, or communicate it in such a way that it is non-ambiguous, and it also allows them to clearly understand the purpose of that particular communication being done. Now, communication, when it is done, and if mission and vision and objectives of the organizations are clearly explained, then it also helps organization make effective decisions. Decision making is a skill, and obviously some part of this needs delegation. So when good leaders actually work and get the teams behind them to go about and achieve the objectives of the organization, they also look at delegating the responsibility of making or taking decisions at different levels within the organization. And this is done on the basis of strengths that they see when they form these teams, that whether they have the capability to be able to make team decisions or individual decisions. And that is where this process of delegation then tends to work. And that also is a very important attribute when we look at the aspect of how leaders are able to, the role of a leader essentially in terms of ensuring that the communication and the communication and the achievement of the aims and objectives of the organization is essentially done. Now, there are other There are lots of other features which we will look at, and attributes which we can talk, and they include attributes, things like integrity. They look at leaders, people who are in that position, who actually are able to promote growth, opportunities for growth for individuals so that you can progress in your career. They are committed. They have long-term commitment towards the organization and towards the welfare of their employees. And obviously, great leaders are also passionate in terms of ensuring, they bring a lot of energy. When I say passionate, they also bring a lot of energy, motivation, positivity towards their role, and they approach and ensure that, employees, staff, peers, when they follow them, they are able to follow them from an aspect of ensuring that they have the same commitment, essentially, towards their responsibility or key results areas within the organization. Now, any questions at this stage, feel free to ask me through the chat route or stop me during our discussion, and I will try and provide additional information if anything is not understood, or if you need more details. Now, leadership as a topic. For those of you who are interested, I have a handout which will be available on Moodle, and that will be called the Leadership Theories. And this particular handout will help you understand the broad context of how leadership theories originated, what are the current theories which are widely accepted, and how they are used within the organization. And from a theoretical perspective, you'll be able to read into that particular handout, which is about 10 to 12 pages long. It's about 15 to 20 minutes read, and that will give you additional knowledge about leadership and leadership styles and leadership theories. Now, the second assessment criteria that we're looking at is understanding what are the theoretical concepts behind fostering team working environments within a leadership role. Now, here we are looking at understanding two basic, models. One work which was done by Dr. Meredith Belvin. Now, he carried out lots of studies. He was a professor of the Hanley Management, College in the US, and his team actually did a number of experiments, essentially to understand the dynamics of how people work within a team. And in order to discover these dynamics of how, when people are put together in teams to work to achieve objectives for the organization, they carried out a number of experiments over a period of 9 years. And then these experiments, which were carried out, essentially led to the development of 9 different types of roles. And over a point in time, in the late 1970s or in the early 1970s, this was then coined in as the Dr. Belbin's team roles model. So when we talk about team building and we talk about the fostering of team building and the concept of team building and team roles, essentially, when people are put together into teams, we refer to 2 models in particular: Dr. Belbin's model of team roles and Tuckman's model of team building or team formation. Now, what we need to understand, there is a handout which I will provide, which is primarily going to go into a bit more detail. But essentially, this experiment, which was conducted by Dr. Meredith Belbin and his team over a period of 9 years, essentially came up with 9 different types of roles that people can take up when they are put together in teams to, work on, or essentially they are put together in teams essentially to, work on certain tasks and objectives which have been set. Now, these 3 different types of roles were also categorized by, Dr. Belbin into, 9 roles, but they were categorized into 3 different categories. So when we talk about these, Belbin roles in general, what we need to understand is that when we talk about these roles, he basically understood how people work, how people behave when they are put together in teams, and depending on the skills, knowledge, and the abilities that they bring to be able to, contribute towards working of the team, they are then divided into, 3 different types. So the first one that he talked about was action-oriented roles. and the second one was people-oriented roles, and the third one was cerebral roles. Now, this categorization was basically developed over a point in time during the studies that they conducted over a period of 9 years. And what they did was they brought across, and finally, when he published this model of team roles in the 1970s, he defined the characteristics of what each of this role does, how individuals in this particular role would show what characteristics, and this allows the leaders in organizations to spot those characteristics and then basically put employees, staff, people, workers in those roles which are suitable to them to be able to contribute positively when they work within the teams. So in terms of this table that you see, he came up, him and his team came up with this model of 3 different types of roles: action-oriented, people-oriented, and cerebral roles. So when we talk about action-oriented, within that he created 3 categories: shaper, implementer, and complete finisher. And they have certain characteristics. So when we talk about shaper, these are people who are highly motivated, for example. They are quite energetic, they are achievement-driven, they are assertive, and they are quite competitive. And then we look at implementers. So similarly, there are some characteristics which these people depict, and these characteristics then help leaders to identify what particular role they are suited to work within the team, and putting them in that particular role bases their skills, knowledge, and the attribute and the behavior they show allows leaders to create winning teams or more productive teams. So this particular handout that I will share with you actually will give you a bit of a history, the background in terms of what the studies were, how they came about these roles, what are the attributes of these roles, and what kind of people would generally be put into these roles basis the strengths and weaknesses, skills and knowledge and attributes they show, and the behavior they exhibit from a point of view of leadership. Now, the second model that we want to quickly understand is the Tuckman's model. Now, Dr. Bruce Tuckman essentially came up with this particular model after doing his studies in the early 1960s, and he came up with 4 stages through which he believed the teams could be formed. When you try and put together a team within an organization, or you put together people from different aspects, different departments, and you bring them together into a particular team to carry out certain objectives or certain tasks, then this process of team formation actually goes through 4 key stages. He added a 5th stage later in the 1970s, and that stage was called adjourning. Now, there are again certain characteristics of each of these stages, and this is what is defined in this particular team formation or team building model. Now, when we talk about each of these stages, what I've done is I've created one odd slide or written a paragraph in each slide to ensure that you understand the meaning of what this stage is and what are the characteristics, of each particular stages. Now, looking at this very briefly, storming stage is a stage where forming the team building essentially starts with the first stage, which is forming as stage 1. So here, what tends to happen is that you put together a lot of people, bring together a lot of people from different departments, different roles and responsibilities into forming a particular team. And what tends to happen is when you have different sets of people coming in from different departments to be able to join a particular team, there will be a lot of arguments, there'll be a bit of friction, there will be disagreements. So basically, this stage essentially is characterized by the fact that people will be, looking at understanding why they've been put together. They will try and build relationships. There'll be a bit of a chaos essentially because nobody understands why they've been brought together to carry out, to basically form this team. Now, the second stage tends to be storming. That means here there are a lot of discussions which will happen, disagreements which will happen. People will try and exercise their influence to say, I will be suited for this role, I'll take up this role. And they generally, this stage generally leads to conflicts, and they need to be resolved by the leader or the team manager to be able to assign specific roles. And this particular stage wherein people then progress into different roles, and here the team manager, the leader, will essentially coach the individuals to take up those roles, will be termed as storming stage. Then the third stage, which is norming. Here, essentially, you look at the team and the people becoming a part and parcel of the team. They calm down in the sense they understand their roles. They understand the reason, aims, and objectives of why they've been brought together into a team. They start to work together and not work together. They start to basically, understand their role. They get to grips with their role. They understand the processes and the working style which is required for them to engage within this particular team. And they would be looking at, building relationships essentially to understand the individuals that they're going to be working with in the short term when they work or long term when they work within this particular team. The fourth stage tends to be performing. So here the team is now fully aligned, fully, fully ready, and they know very clearly the objective of why they've been brought together. They know very clearly in terms of why they have been put into this particular team and what are the objectives which have been given for them to be able to resolve or work towards. So there's a relationship, disagreements disappear, there is a high level of autonomy, there is high level of dependence within the team. And then last but not the least, they are working as a coordinated unit. And this stage tends to be the performing stage. Now, when the objectives are fulfilled, and at some stage, when the reasons why this team was put together has been fulfilled, the teams can also be adjourned. And simple example could be like when we look at the COVID-19 pandemic, a lot of, when the vaccination drive started, as you would see, pharmacies, GPs, local surgeries, community healthcare centers, hospitals, all the departments were brought together and people from all different departments were brought together to essentially effectively help the rollout of the vaccination. And this was done under the, leadership of the then vaccination minister, Nadeem Zahawi. And essentially, once this vaccination drive, has got filled, has got completed, and, it started with over 80s, vulnerable people with underlying health conditions, then 70 to 80s, then 60 to 70s, different age groups. So there was a plan behind it. There were people brought across from different departments. Dr. Nikki Kenani, which was brought across, as a central coordinator in NHS England and Wales to be able to, look at this particular vaccination drive. There were different people brought together from different departments. But once this particular vaccination objective was achieved and most of the population, received the first dose, the team and the functions of this particular team were then delegated to different departments. And today, when you go out and get your booster dose or, a booster, dose for the COVID vaccine, you basically go to your GP surgery and they would do it rather than going and looking at other places like community centers, pharmacies, and things like that. So here, what they've done is they put together a team under the leadership of Boris Johnson, Nadeem Zahawi becoming the vaccinations minister, and then he put together a team to drive this out. And as the objectives of the team and the vaccination drive were accomplished, slowly and gradually the team was disbanded. People went back to their normal jobs, and there are some people which still continue to be in this role, but generally you would see the most of the team and team members have gone back to their different roles because they've achieved the objectives of working together as a team to achieve vaccination, and that has helped us overcome the pandemic. So this is the fifth stage that we look at, which is the stage that we want to understand in terms of adjourning. Now, a couple of other things which are given in the indicative content, especially on this assessment criteria, is talking about the aspects of theoretical aspects of what are called management theories and how they came about. Now, there are some, if I look at management theories, there are three different types that we talk about, or three different phases in which they came about. So we look at the scientific experiment, which were carried out by, Frederick Taylor. These experiments were carried out primarily, when he looked at observing people in factories. And essentially, he came out with a few recommendations saying that in order to increase productivity of the workers within the factory, if they were given more incentives, if there was an efficient planning behind it, then this could lead to more productivity and workers being more productive. So the experimentation and details are given in a bit of a handout, which I will share with you on Moodle. Now, the second school of thought was essentially bureaucratic management process. This was primarily Max Weber's, initiative into understanding the process of management and how leadership and, management work. So he did some experimentation and observed, people working within factories and, obviously looking at different aspects of how, leadership can influence working styles within an organization. His approach was to understand what is the structure of the organization, how the division of work is done within the organization, how do you select new employees, and formation of rules and regulations. And this then helps establish clear authority, responsibility, formal procedures and processes, and it separates management from ownership of the organization, which allows workers to work independently. So this was the second school of thought, wherein he said that workers should be concentrating on increasing productivity and efficiency, and this is primarily done through bringing in managers, which would help monitor the day-to-day jobs of how workers work within factories. The third aspect was looking at administrative management approach. Now here, Henry Foyle, who was a French scientist, basically looked at conducting his experiments, and he basically came across with the three basic concepts that when you look at things from a perspective of organization and let's say productivity, you have to take into account the 5 principles which essentially can be useful in let's say these 5 principles can be useful in essentially managing workers with any sort of a setup. And this tends to be when people understand what is the vision and mission of the organization. They understand who is at the top of the organization in terms of leadership, and they have a very clear job description and understanding in terms of what is required of them in terms of their roles and responsibilities. So these aspects of theories that we look at are quite important because they are related to how leaders develop leadership styles within organization, and which leadership style works best in what organization has led to the development of a lot of leadership theory. So these experiments, which were carried out in the late in the 18th and 19th century, essentially helped in the development of leadership theories that we get to see in today's context. So when we talk about human relationships theory, here we talk about Elton Mayo's Hawthorne studies, which he carried out within the factory. And here his central assumptions in terms of how he studied was that if adequate lighting is provided, good facilities are provided, to workers, then they generally tend to be more productive. And he kind of proposed a carrot and stick approach, saying that employers and leaders or management essentially should focus on motivating employees and getting the best output from them by taking up what is called a carrot and stick approach. And in this case, his experimentation and the studies that he carried out essentially focused on driving a link between motivation, leadership, and reward mechanism, which allows leaders and managers to effectively manage workers within an organization. So these are, I would say, theoretical concepts that you need to be aware of, which will be useful for you to understand how team building happens, what is the, let's say, dynamics of team formation, and also why and how motivation theories, came about once these scientific experimentation was done, and that allows leaders to use appropriate style of leadership while, ensuring when they set the vision and mission of the organization, it ensures that they are able to set an adequate style or use a particular style which works best within the organization. So I've detailed these out in a bit of a slide because they're covered in the indicative content, and I would suggest that you go through these to build a bit of a knowledge and understanding of why they were important and how these scientific experiments led to the creation of leadership styles and motivation theories that we get to read today, which are very well established, like the Maslow's theory of hierarchy and things like that. Now, any questions on this so far?
Yeah, my question is that my network was really messing me up today. But then, like the little that I had, I need more explanation on motivational theory, sir.
What the stories are, sorry?
Motivational theory, sir.
So, in this case, Rose, this is a theoretical discussion that we need to do. There is a handout that I'm going to provide on motivational theories. And that handout on motivational theories would be a good reading for you to do, because they are essentially tools and techniques which are used by leaders or managers in organizations to essentially get tasks done, to drive performance across the organization. So when we look at leadership theories and when we look at motivational theories, there are lots of these leadership and motivational theories which we can study, and they are essentially grouped into various types. So in general, when we talk about motivational theories which you're asking, there will be a couple of them that we will look at studying, and that will be, say, for example, the Maslow's theory of hierarchy, in which he, when he did came up with his theories in the 1940s, he basically said that humans have a basic need. Because of that particular need, they are driven, and he came across with a pyramid which is called the Maslow's theory of hierarchy. So he talks about physiological needs, food and shelter needs, love needs, self-esteem needs, and self-actualization needs. And that is where he proposed that in order for leaders to get work done and to ensure that workers are able to help in achievement of aims and objectives of the organization, leaders need to understand what kind of needs do the workers and employees have, and if they are able to meet those needs by providing or adding incentives at each particular level, then it will help workers be more motivated. They will be more productive, they'll be more loyal towards the organization and focused towards achieving those aims and objectives which have been set by the leaders. So an example of physiological need would be that sometimes when we see people finishing their degree and they starting their first job, their main aim is to basically get into a job profile at the end of the day, so that they can start earning. And their main aim in terms of physiological needs is primarily to ensure that they are able to essentially work, and they're essentially able to get or earn a livelihood. When we look at the top of the pyramid of what Maslow proposed, when he talks about self-actualization, here people have experience. They are more interested in now putting things into practice because they've gained a lot of experience over the years. And obviously, with this particular aspect of having the knowledge, the skills, and the experience, they are basically seeking what is called reputation. They are seeking what are called public recognition. And in those cases, if people don't realize that I have 20 years of experience, I have a lot of knowledge in terms of what I've done in terms of my previous roles, I am probably at the top of my career. But if I'm not given opportunities to develop in terms of putting those things into practice, then at some stage, what tends to happen is that I might look at leaving the organization or find other opportunities where I'll be able to use some of the my experience that I want to now put into practice, which is self-actualization. And if that is not realized, then sometimes organization end up losing a good resource or somebody who's important or has been quite loyal to the organization, but they end up losing it because they have not been able to provide the right set of opportunities which the person is looking for. So there are lots of these models, one of them being Maslow's hierarchy of needs. There is the McGregor's theory, where he proposed theory X and Y. So there are two parameters. There is a Herzberg's theory model, and there are a few others which basically also build on how motivation needs to be looked at in an organization, and why is it important for leaders and people who are in the managerial supervisory position to understand what are the basic requirements which motivate an individual, which drive an individual to be able to do their work or day-to-day activities, and how they can be rewarded if they do their jobs well, how the rewards essentially or the incentives essentially promote loyalty towards the organization, increase productivity, and make them more professional in terms of delivering their work. And that is where the aspect of these motivational theories essentially comes in, because a lot of work was done in the early 19th century and the late 20th century to establish these models, and a lot of experimentation was done essentially, or studies essentially were carried out by some of these physiologists, psychologists and scientists, who have then proposed these models of what are called theories of motivation. And that is what you would need to understand theoretically to make sure that should you get into a leadership role, should you get into a managerial role, then you need to understand what drives your workers, your peers, your colleagues, how they are motivated, whether they are motivated by money, whether they are motivated by respect, reputation, or they have basic needs of, providing food, shelter, and basic aspects of ensuring that they are able to manage, their day-to-day, activities and have money to be able to pay for bills. So that is what you'll have to read and understand when you talk about, motivational theories and the application of them towards the understanding of why is it important for leaders to understand what drives the employees or the people in that role, and having that understanding then help them put together rewards, incentives which are commensurate to their expectations, and in return they are able to get the work done or help complete set of activities or tasks which are then required to achieve the overall objectives of the organization within a particular time frame or within a particular financial year. Is that okay? So you would be looking at maybe reading a handout which I will have on Moodle, and because it is a couple of theories that you need to go through, I think it's a discussion which is best done offline, considering that you have to go through this, you have to just go through the theories which have now been established and then understand how they can be applied in various situations. So particularly here, the health and social care sector. Now, the third assessment criteria that we're looking at is primarily understanding, what is the importance of, once we've understood team and team formation and team building, what we want to now do is understand the importance of how developing a team promotes professionalism, mutual trust and respect as far as, the working within the health and social care sector is concerned. So when we talk about, the person-centered approach and the 6 principles of person-centered approach, we generally look at these principles as individuality, independence, privacy, partnership, choice, dignity, respect, and rights. Now, this part of it that we talk about essentially is important, because when we talk about people working within teams and they having to show certain characteristics and attributes to be able to work as a team member, they would naturally be required to adhere to these principles of what is called professionalism. And it is expected of individuals working within this sector that you then tend to work with certain professional ethics, and these professional ethics essentially help in delivering of standards, maintaining services to particular standards, and this allows the services and the standards to be essentially delivered to what has been set by the Professional Standards Authority, PSA, and the CQC. So when we talk about teams, we talk about a group of people being brought together to achieve a common purpose or to work towards a common objective. We talk about people essentially within the NHS and the health and social care sector working in multidisciplinary teams. So it's not just teams, but it is multidisciplinary teams, because you have a combination of different types of people working and coming together to be able to provide care to patients. So it is doctors, nurses, paramedics, pharmacists, community healthcare workers, occupational therapists, you have, physiologists, you have lots of different types of people, healthcare workers, assistants, a lot of different type of individuals coming together. And that is why we take this approach of multidisciplinary teams, because you are coming from a different background, different skills, different knowledge. You are looking at delivering one particular coordinated objective or aim of providing integrated care to the patients. And in those cases, it is working within multidisciplinary teams. And sometimes these teams are formed of partners, suppliers, people from different departments, but essentially the main aim is to deliver integrated care. Now, what is the importance of professionalism in health and social care? The importance of professionalism in health and social care is that it helps in delivering critically, helps in delivering care, but care which is adhering to safety standards. They're adhering to the national standards or the occupational frameworks which have been put in place by the regulators like Professional Standards Authority and CQC, to ensure that the safety of the patient is paramount and is being done without compromising any set objectives which have been put into place when this care is being delivered. Now, when we look at these professional parameters or professionalism which is required is essentially, some parameters that we will talk about. These parameters are basically parameters which are related to how you follow say, for example, how you understand and implement the laws and regulations which are put in place, how you look at managing your behavior in the organization or in the environment when you're working. What are the knowledge, skills, and abilities that you bring across along with experience when you come to the place of your work? And how do these professional abilities, which is your knowledge, skill, experience, allow you to then deliver a particular standard of service to the patient, whether it's staff, employers, colleagues, is what is considered as professionalism within health and social care. Now, when we look at certain aspects of professionalism, we look at behavior in general, we look at your values, your cultural beliefs, we look at your knowledge, your skill, and the academic or vocational skills that you bring across to the to your job profile. Now, in this case, when we talk about behaviors, we are essentially talking about the attitudes that you are portraying, which would be influenced by the beliefs that you have, and these then can be further broken down into values. And then in these values, how you make sure that you're not making judgments, you're not being judgmental in terms of when you communicate or when you basically provide this service, and you're providing it as an unselfish act in terms of ensuring that you're maintaining professionalism, but also, or when you say maintaining professionalism, is you're maintaining and delivering to certain guidelines which have been set as standards, and that is being done as a selfless act or an unselfish act. And in those cases, that would be deemed as professionalism. Now, if I say, for an example, that how we look at professionalism. Now, if you're a physician or a doctor or a medic, and you are finishing your day shift, and there is, you're about to leave your work, but there is an emergency or an accident which comes up, and you're asked to attend to that particular, task, because although you've ended your day shift, but because of this emergency which has come in, you are required to attend to that emergency. Now, instead of leaving the hospital, and if you're having your personal appointments or you had personal plans, but instead of leaving the hospital, you attend to this particular emergency to ensure and save the life of an individual, then this is seen as professionalism, because you are committed to your work, you're committed to unselfishness act, or you act selfishly in order to delay your personal commitment, but in this case attend to the appointment, which is the emergency, or a child which has been brought in, which has had an accident, or an adult which has been, just as an example, and that would show professionalism from an aspect of a medic or a doctor. Now, there are lots of different examples that you can put in place, and obviously anything which basically relates to your work directly, and that you go above and beyond to deliver that particular bit of work, would essentially show professionalism that you bring across at your place of work. Now, professionalism can also mean trust, can also mean respect. Now, when you work with other colleagues, other peers, and you work in multidisciplinary teams, you respect others' privacy, independence, decision making. This is also showing and exhibiting professionalism at your place of work. Professionalism can also be shown when you are looking at adhering to standards, when you are looking at delivering your services to the highest possible standards which have been defined by CQC, the Quality Care Commission, and the Professional Standards Agency, which are then implemented as guidelines in terms of policies and procedures within your organization. And that when you follow to approach patients, to provide care, to provide service, to provide information, is also showing how you are exhibiting professionalism and observing professionalism in your work when you deliver your services. Now, one of the things which I'll ask you to do in terms of just as an activity would be to take up this particular quiz, which is on the site, which talks about, essentially NHS careers. Now, if you want to understand what are the different careers that you can take up within the NHS, specifically looking at, the different types of careers which are available to individuals within the National Health Service. This particular site, if you use, is going to give you a survey, and this survey, if you undertake, would allow then you to essentially, answer a few questions, and basis the, questions that you answer, you are going to be then suggested some roles that are suitable for you within the National Health Service. Now, if you look at, there are no right and wrong answers. You have to read the question and you answer to the best of your ability. And once this is completed, it will recommend you certain roles that you bases your skills, your experience and knowledge, and the questions that you answered, which is gathered it from there. It will recommend you some roles, and that would be a good way of understanding what would be the suitability of roles that you can take up within the National Health Service. And this is going to be helpful for the next set of discussions that we want to have for the assessment criteria 4.4, wherein it talks about the concept of continuous professional development or career professional development. Now, when we talk about professional development, this is directly related to the day-to-day activities that you carry out as a worker, as a colleague within the within the healthcare National Health Service or the health and social care sector. And here, professional development essentially corresponds to you being able to grow your skills, your knowledge, your abilities to be able to deliver to professional standards the work that you carry out on a day-to-day basis. And this provides you opportunities for you to be able to learn and put those learnings that you have gained from your experience, from academic knowledge, from observing people, from getting coaching or mentoring, and putting it into practice in your place of work to deliver effectively care services to patient at the desired standards set by the organization, is basically the process of continuous professional development. Example, if you take that, if your organization, you're working within the NHS, you work within a department wherein you work with the MRI machine or the CT scan, and there is a new version of the machine or the new version of software which has been introduced. Now, in order for you to be able to use that machine effectively to do scans or prepare reports, you would be required to be trained, on the new version of the software. What are the advantages? What are the updates which have happened? What are the key bits that you need to observe while you're, using the machine? And if you're given adequate training and you are given details about how it is different from the previous version, and, does it have additional features, then in those cases, doing a training to understand all this would be helpful for you, because it will help you work with that particular equipment more effectively, and that would allow maybe more meaningful reports to be produced, which then can be shared with GPs, consultants, doctors, nurses, and they would be able to produce a better diagnosis for patients to be able to overcome a particular disease or illness. Now, Professional development, when we talk about, there are lots of experiments and again studies which have been done earlier in the 20th century, and this was primarily when people started to understand that there's a large amount of money being spent on developing individuals, employees, workers within the organization, and this is primarily what is called workforce training, or basically training and development. Now, this high investment essentially should lead to productivity and more effective results in workforce being more skilled, and in more essence, being able to deal with challenges at the place of work. Now, a lot of research which was done also showed that countries which have highest amount of productivity were the ones which were focused more on delivering more training and development to employees, which allowed them to sharpen their skills, and as a result the objectives were easily achieved, or were achievable. Now, here is where the role of leadership comes in, because the leadership role is to ensure that the organization is focused on developing skills, always looking at enhancing skills. And if there is a commitment from the leadership in terms of this particular spend being done within the organization on training the individuals, identifying their gap areas, asking them to retrain or reskill so that they are able to work more effectively, is driven through the commitment and sponsorship of leadership, sponsor in this case, and that would be the leader, because they are committing a certain amount of expense or a certain amount of budget towards this course, this particular work of training and development within the organization. And this emphasis that they put on the workforce professional development is basically driven at the top level. And this involves, working with in terms of various teams, and also ensuring that they put into place various strategies which will allow workers to train and develop and then perform at their utmost level while they work and take up day-to-day responsibilities. Now, theoretically, we want to understand what is continuous professional development. Now, Klobb's experiential learning theory is the work that he had done, wherein he basically said that after conducting, say various, experimentation and work, he basically came up with this particular, process, which basically says knowledge results from a combination of grasping and transforming of experiences. And he came across with what is called the Klobb's experiential learning, cycle. And in the 1980s, he basically developed this model into a four-step learning cycle, which is what is now synonymous with what is called the Klobb's theory, or the Klobb's learning, experiencing learning theory. Now, in this particular cycle, in this particular experiment and the studies that he did, he said that the impetus of development of a new concept is provided by new experiences. And learning, for him, he defined it as a process through which knowledge is created, and transformation of experience, creates knowledge. So when we talk about his particular work, he came up with this 4 stages of learning, which consider that experience is constructed by processes of, intention, extension, apprehension, and understanding. And in this proposed model that he came up with, he divided this into 4 different quadrants. He talked about concrete experiences, he talked about reflective observation, abstract conceptualization, and active experimentation. And each of this quadrant essentially, talks about how an individual learns and what is his preferred, learning style. So concrete experience means people learn when they encounter an experience themselves. They would want to go through a situation, and then reinterpretation of that existing situation helps them understand the information or the concepts better. Reflective observation tends to be when learners reflect on new experiences in the light of their existing knowledge. That means they consider their experience that they've had and the knowledge that they've had, and then compare the two to see what are the inconsistencies, and then they look at building their expectation on what they could expect by undertaking that activity. Similarly, abstract conceptualization organization talks about reflection that gives rise to a new idea. That means they are looking at basically a person who would have learned from his experience and then would like to put into practice what they have learned, and that would be by constructing different ways through which they would experience that or go about doing an activity. And last tends to be active experimentation, which is basically concepts which have come across by doing experimentation, and here the learner was essentially applied that idea before they would want to go on to try something different. So they want to experiment by what in terms of putting into practice what they have learned, and this tends to be the last aspect of what he proposed. Now, when we look at these learning styles and when we look at how people take up learning within the organization, it is important for the leaders to be able to understand that you as an individual or a group of individuals that they work with within the organization, what learning style they have, and then the leaders have the responsibility to put them into by doing those activities so that their learning can be more effective. And that is where the club's learning styles essentially comes into play. And this is where the leaders, when they identify what helps you develop and what helps you progress, they then look at putting this process of professional development into place by relating them to the styles of development that you would be best suited for. And then they, let's put it this way, put this plan of continuous professional development in place, which is done either through the human resources department or through the creation of, an appraisal system, which identifies the gaps that you have in your skills, your knowledge, and the trainings that you need to go through in terms of developing and adding that skill and upping your knowledge within the organization, which is where it will thereby help in achieving the objectives of the organization. So they play a very important role. When I say they, I mean leaders or leadership plays a very important role in ensuring that appropriate budgets are kept aside for the process of training and development. The process of training and development is identified, and certain activities are put in place depending on what is the best learning style for that particular individual, and then ensuring that there is a buy-in essentially to work through and then budget for this professional training which has to happen for the individual, and that would ensure that the individual, one, is productive, is progressing. Third, it provides him growth opportunities with the organization, and the most important part of it being that the individual following these the individual then, because of the skills that they've gained, the knowledge they've gained, that allows them to essentially look at ensuring that they're able to provide service and basically work to the standards which are required within the organization, thereby ensuring that the care standards don't slip, the regulations are followed, policies and procedures are implemented, and as a result it provides the integrated care which the patient requires when we look at the health and social care sector in general. So this particular aspect of why professional development and the role of leadership in the development of professional continuous development within the organization for individual is important. And this is summarized in this particular image, which talks about, how leaders can act as a transformational, take up a transformational role, wherein they help in encouraging informal learning, they help and put incentives in place to ensure learning happens. And last but not the least, they ensure that there is a conducive environment which is developed essentially for and put activities in place which allows the development of training and development of skills to overall happen within the sector which is required. And that thereby ensures no slippage of standards, high standards of care, professional turnaround times, ensuring there is no stress on the system and in terms of the individuals which work, and they understand what work they have to do and how their work contributes to the overall delivery of service standards within the National Health Service. So if you're keen as an activity, again, I would put it this way, that if you're keen, then you should look at creating what is called a PDP or a personal development plan, and you can use this particular template. Some of you, for example, are doing this particular course, and the reason of you doing this particular course is that some of you are looking at stepping into the compliance manager or the registered manager role within your organization, which is responsible for ensuring compliances, regulation frameworks are all followed, and they are developed into policies and procedures which allow then service standards to be maintained in your organization or the place of work within health and social care sector. That is maybe a care home, or a clinic, for example, a nursery, or a children's nursery, whatever that may be. So maybe as an activity, if you want to look at developing your continuous development plan or keeping a plan for personal development, then you could use this template to create that, and that would help you essentially put the theoretical understanding that we've discussed for assessment criteria 4.4 and then put it into practice by developing what is called a plan for yourself for continuous development. So I hope with this discussion, you've understood the learning outcome for today, that we have covered slightly a longer session, keeping in mind that this learning outcome required us to delve into a lot of details, specifically some of the theoretical aspects. So here, what I would suggest is there is some additional reading that I would add, and that would be useful for you to look at. So one would be the leadership theories, and the other would be the motivational theories, which could be good reading in terms of the handouts that I will put on Moodle. And apart from that, there are two very nice articles which are directly related to this particular unit, this particular learning outcome, which is talking about how to lead and develop in the area of health and social care. There's an article which talks about what defines true leadership in healthcare, and then the other article which talks about mentorship, the heart and soul of healthcare leadership, which is going to be a good 10 to 15-minute reading. And I would encourage you to do that in order to develop a bit more understanding in terms of what we've discussed today with regards to learning outcome 4. So any questions at this stage, I'll be more than happy to take, and I'll be looking at closing the session. I know it's been a bit long than usual, but the idea is I wanted to ensure that we are covering the indicative content given in as much detail as possible, and it gives you the detailed information which is required essentially for the purposes of covering this particular learning outcome and the last one in this particular unit. So any questions at this stage, more than happy to take. If not, then we'll be looking at bringing this session to a close, and I'll catch up with you tomorrow in order to discuss the assignment discussion for this unit. And then we'll be looking at you submitting the assignment towards, I would say, the 10th or 11th of January for this unit in terms of closure.
Okay, sir. So please, little bit explanation between concrete experience and the abstract conceptualization.
So when we talk about CLOB's learning cycle in general, the model that he came up with essentially talked about 4 different phases through which individuals go through for the purposes of learning. So if I just share the presentation again, in this I have skipped 1 or 2 slides because again this is theory. So what he proposed was that when we talk about the process of learning or effective learning, there are lots of different types of learning processes. You could do self-learning, you could do learning which is driven by your employer, which is done normally through training and seminars and group discussions. There is self-managed learning. That means you do the learning yourself, you're able to manage your learning. And when he did the conceptualization of this model, he came across with the concept that effective learning can happen, and it happens in 4 stages. So it starts with experience. Then once you have had an experience, like for example, if you look at putting your finger over a flame of fire and your finger burns, you have had an experience that if you put your hand or your finger over fire, it can burn. Now, once you've had that experience, you will never do that thing again in terms of putting your hand over fire, because you know that this results in pain and you suffering burn. So Then after your experience, you're able to reflect on what are the consequences of what action you've taken. And then next time when you look at doing something, you are using your existing experience to look at assumptions of, if I do this way, this will result into this. If I do this way, this will result into this particular type of outcome. And this allows you to create those conceptions or conceptualization and then test which one is the best one to do. Another example that I would give you is, if you're going from Manchester to London, what you would want to do is, the first time you go, you've traveled and you've driven by car, you've had an experience, 4, 5, 6 hours of driving, traffic congestion, you stopped over a couple of services and you reached finally the destination. The second time when you would go, you would actually reflect on, hang on, I should have actually taken the train, which would have been much more easier because I would have reached in 2 hours, although it would have been a bit more expensive, but more comfortable. I could have had a good amount of interaction with a lot of my family members or colleagues. It would have been less stressful and, much easier because I wouldn't have been bothered about driving and, time. That allows you to reflect. Then if you want to look at the best experience that you want to have, and you want to also have some of the best and avoid the worst that you had when you've driven and when you've gone in the train, you would look at conceptualization of saying, okay, what could be the other ways in which I could travel? Can I take a flight, which is much shorter, or can I take a bus, which allows us to make regular stops and obviously allows us to see other locations? So what you're trying to do is here actually look at conceptualizing what could be the other forms of other ways through which you can travel, but maybe travel in a better, in a much more controlled fashion, or in a way wherein it'll be much more conducive for you. And then you test it out. So sometimes you travel in the bus, sometimes you go in the flight, but over a point in time, you basically decide that if I have to go from Manchester to London, the best transport in the cheapest possible cost and the most affordable way to travel would be take a train, because it'll take me 2 hours, and then I'm not stressed and I'm not spending too much. And that process that you do, you're going through a particular learning curve, and that particular learning curve, I would say, could be putting the CLOBS learning curve into place. Now, your question was, what is specifically about abstract conceptualization and active experimentation? So when we look at the 4 quadrants of abstract conceptualization and active experimentation, here what you're trying to do as a learner is that in the first one, abstract conceptualization, you are trying to use logical approaches and theories and your interpersonal feelings or issues that you've had or the experiences that you have to understand the situation and the problem that you're faced with. Now, in those cases, when you look at this as building up of theories and logical approaches and rational thinking, and then come to solving a particular problem, you would be looking at learning from your experience, building on those as theoretical concepts and assumptions, and then carry out something that you are intending to do. And when we talk about active experimentation, here what you're looking at doing is you are eager to experiment, you are eager to jump in, you're eager to start. You are more of a person who wants to learn from experience. So you would be happy to experiment and carry out different types or undertake different types of experiences at the different situations to learn from them. And that is where you're looking at active experimentation. So here, your approach is going to be more practical rather than rational, which is more in abstract. And you're going to be looking at, sometimes observing the situation rather than acting on it, because what you want to do is, yes, you want to experiment, but you also want to understand what is happening around you and how people are doing things around you. You might simply want to sit back and relax and observe, and then taking that observation in, you want to then do an active experimentation in the way that you've understood and the experience that you want to have. And that would differentiate, the two processes or the two learning types. So abstract being more rational, looking at constructing and looking at logically this situation. Active mean more you are trying to experiment, but you're trying to observe others, and then you're looking at taking a practical approach of how you would go and implement this by observing somebody else's way of doing things first, but then adapting it to the style that you would want to go ahead with, and that would be termed as active experimentation. Is that okay?
Thank you very much, sir.
No worries. No worries. Okay. So what I will do is I'll end the session today and then I'll catch up with you tomorrow to discuss the assignment and we'll do a bit of a recap. So if you have any questions at that stage, feel free to write them down and then we will discuss in the session tomorrow. But thanks for joining the session today and I will see you tomorrow at 9 a.m.
Thank you, sir.
Thank you. Take care.
Thank you.
Bye. Bye for now.